Let's be honest, doctors don't get a lot of training on lymphedema in medical school. Maybe they'll get an hour here or there. But really, a lot of physical therapy programs also don't go in depth on lymphedema. Lymphedema is complex, but not all swelling in the legs or in the body is diagnosed or defined as lymphedema. Swelling can be caused by a lot of different things, such as vascular issues like venous insufficiency, such as a back above the kidneys, lymphatic issues, or even just genetic conditions. So yes, diagnosing and treating swelling can be challenging. My name is Kelly. I am a physical therapist as well as a certified lymphedema therapist. And as a lymphedema therapist, I have seen a lot of individuals come through who have been told various things about their lymphedema or their swelling that are not always helpful or accurate. So today in this video, I'm going to go and talk about the 5 things that I wish doctors and therapists knew about lymphedema. But before we begin, make sure that you subscribe down below, and you can follow along on Instagram for more related education and content. Probably the number one thing that I wish they knew is that ACE bandages are not effective, nor are they safe for lymphedema. We use what we call short stretch bandages. Yes, they look like an ACE bandage, but they are different. It's about the way that the fabric is woven. An ACE bandage is a long stretch bandage, and again, we're using a short stretch bandage. A short stretch bandage has a low resting pressure, so meaning when someone's at rest, and a high working or active pressure, which means they are less likely to cause a tourniquet and they're going to be less painful. An ACE bandage is the exact opposite. It has a high resting pressure and a low working pressure. This is going to put someone at a higher risk of having that ACE bandage dig in and be painful. And when you have that tourniquet effect when it digs in, someone's at a higher risk for skin breakdown or wounds, which puts them at a higher risk for infections. And so we really want to make sure that we're using the right and the correct type of bandage to help reduce someone's swelling. I will place links for a couple of the main brands of short stretch bandages down below to check out. Another thing that I wish that doctors and therapists knew about lymphedema is that putting someone in a basic compression stocking that you get at a drugstore is not going to reduce the volume and shrink them down, except if they have very mild swelling that maybe comes on at the very end of the day. Compression stockings and garments are maintenance garments, which means that they are meant to help keep someone's swelling and volume at bay. They are not meant to reduce someone's swelling. And so if someone has moderate, severe swelling or lymphedema, they need to go through complete decongestive therapy with a certified lymphedema therapist first, using the short stretch bandage that we just spoke about, along with other foams and paddings to reduce the volume and reduce the size. And once we get someone's volumes and their swelling down as much as we can, then we can transition them to a compression stocking to help maintain that reduction. But yes, like I mentioned before, if someone has really mild swelling that just comes and goes after being on their feet too long, they may get away with going into a compression stocking or garment right away to manage or reduce their symptoms. But just be aware if someone has more moderate to severe swelling, they're likely going to have to go through a little bit more of a process to really get that swelling down. So the next one is also about garments and stockings, and that is that not everyone can just go to the drugstore and get a basic compression stocking and have it work. The type of compression and the amount of compression does matter. There are 2 basic different types of compression garments. One is the circular knit garment, which is an elastic garment, and one is a flat knit garment, which is an inelastic garment. The flat knit garment does contain edema and swelling much better, and for those with lymphedema, especially those with moderate to severe, will really need a flat knit garment to contain and manage their symptoms. For someone who has more mild to moderate swelling that is more vein or venous insufficiency like, they may be able to get away with a circular knit garment that is a little bit thinner. However, those with moderate to severe, this is really just not going to be enough to contain in the fluid. The other risk someone has, depending on their body habitus or their size or shape, is that the circular knit garments do put someone at a higher risk for a tourniquet, especially around the ankle areas or around the knees or on the elbows or wrist. That basically means that these cut in or dig in really tightly. And so if someone knows that they have pain with these, or they have irritation, or they might have skin breakdown, which is a risk for infection, these type of garments are not going to be as effective, and they may need to look more at a flat knit garment. And so it's not expected that someone knows all about these different types of garments and can keep them all straight, because there are hundreds of them out there. But I will link a couple of my favorites for each type down below. And then it's best to talk to a certified lymphedema therapist or a local fitter in the area for each patient to get and find what they specifically may need. The fourth thing that I want doctors and therapists to know about lymphedema is that not all swelling is lymphedema. The term or the diagnosis of lymphedema is used really loosely, but it's not always correct. There are a lot of different causes and reasons for swelling in the body. The vascular system can cause it, such as venous insufficiency. It can be caused by kidney issues or dysfunction. It can be caused by the lymphatics, or it might even be lipedema, which is edema that arises or sits in the adipose or fatty tissue. It's really important to know and figure out what is causing the swelling so that it can be medically addressed appropriately. But yes, a certified lymphedema therapist can help with all of these conditions and all types of swelling. So referring to a CLT is the correct thing to do as well. But yes, for many individuals and patients, it can be multifactorial, meaning they can have multiple of these diagnoses, such as lymphedema and lipedema. But really, it's just important to have the true diagnosis and causes of the swelling so we can look at that and treat it from there. The fifth and last thing I want doctors and therapists to know about lymphedema is that it is a chronic condition, and these patients are going to need long-term support. Garments and supplies are incredibly expensive. In the United States, Medicare doesn't cover these costs, which can be thousands of dollars a year. The Lymphedema Treatment Act is in progress, but it has a long way to go to help support these patients financially. Just make sure that you work with a certified lymphedema therapist to look at the patient's volume measurements, to look for any progressions of the disease, look at their skin, look at their fibrosis and tissue changes. Make sure that they're getting new garments and new compression every 4 to 6 months or when they start to stretch out. And also know that they are at a higher risk for infection, so be ready for any referrals to infectious disease or antibiotics as needed. And lastly, please just be kind and patient. We all know that chronic illnesses and diseases are really challenging. These patients put in hours of extra self-care each and every day to help manage their lymphedema and to stay healthy. So those are the 5 main things that I wish doctors and therapists knew about lymphedema. We are grateful for those who are willing to learn more to help best support their patients. It takes a village and a whole team, so hopefully we continue to collaborate to help support these patients and this community. Thanks everyone for watching, and we'll see you all next week with another video.